Coronavirus. New research suggests it could also help cancer patients live longer.
But doctors warn more research must be done to confirm the vaccine's cancer-fighting power. Sarah Shackles on your side with details.
Cancer researchers say they started noticing a positive pattern among their patients undergoing immune therapy for their cancer treatment who had also received a COVID mRNA vaccine versus those who hadn't. And they say it gives them hope for the future.
What we found is that the COVID mRNA vaccine acts like a siren to activate the immune system. And in patients with cancer, the immune system gets activated inside their tumor and it gets reprogrammed to start killing their cancer.
Dr. Adam Grippin, a senior resident at the MD Anderson Cancer Center in Houston, is helping lead the research.
In looking back at over 1,000 patients with cancer who were treated with immune therapy at MD Anderson, we found that those patients who happened to get the COVID vaccine around the time they started their immune therapy lived significantly longer than patients who didn't get that vaccine.
One of the challenges with immunotherapy is that only about 20 to 40% of people who receive immunotherapy have a meaningful response.
What this research suggests is that an already available vaccine could be the secret to boosting a cancer patient's own immune fighting power.
The thinking is basically that the mRNA and the vehicle, or the way in which the mRNA is delivered in and of itself, actually augments the immune system by boosting the T cells and other cells that are really important to fighting off a cancer.
But doctors warn clinical trials are still needed to confirm the link.
Our results are extremely exciting. If the results bore out in phase 3 clinical trials that showed that an off-the-shelf mRNA vaccine might improve patients' response to their immune therapy, that could dramatically change the way we treat cancer in the future. And that is why we are working so hard to get that trial up and running to really validate this effect.
He tells me they're looking to get 500 people signed up for this phase 3 clinical trial. And once that's underway, it'll still be a few more years before they have the results. In Richmond, Sarah Shackles, 12 on your side.